So you're thinking about having Botox maybe for the first time under 40, and you're wondering, is there anything that I should be aware of, any special tips or any downsides? So I'm Dr. Owen Thomas, aesthetic doctor in London, UK. Stick to the end and I will tell you all I know about Botox and how to use that, and any special tips and pointers for people who are having it at a younger age. This video is going to concentrate on the upper face. That's where most Botox is used, especially when people start. There are some other really good indications that I'll mention as we go through the video. So what is Botox? As you might well be aware, Botox is a brand name. It's the top brand for botulinum toxin, but there are several others. There's about 5 in the US. In the UK, we've got 3 or 4. In the UK, we have Botox, Bocuture, and Aslua. Aslua is called Dysport in the US, and Bocuture is called Xeomin, and there are also a couple of others that they have in the US. But all of these are roughly similar. Depends on the amount of proteins that complex around the Botox molecule, but the actual Botox molecule is exactly the same. So the story starts in the late 19th century when there was an outbreak of sausage poisoning, and investigation by scientists led to the discovery of the bacteria Clostridium botulinum. And then through the 20th century, that got purified, and in the 70s, this was used in conditions around the eye to reduce spasm of the muscles. After years, a dermatologist in North America called Dr. Jean Carruthers was using it for treatment of blepharospasm around the eyes, and she noticed that people were remarking to her that the lines around the face seemed to be softened. One of them said that they had a beautifully untroubled expression, and this led to a little bit of investigation and research, and hence the aesthetic indication for Botox was born. It received a license for treatment of lines and wrinkles in 1989, and from then on, Botox has gone on to be a global phenomenon. So Botox is injected underneath the skin with tiny needles into the muscle or around the muscle. It diffuses into the muscle cells, and it blocks an enzyme which releases a transmitter, so ultimately the muscles don't know that they should be contracting. The Botox takes a little while. There's a lag between treatment and onset of action, usually about 2 to 4 days to see any change, and about 10 to 14 days to get to maximum. So ultimately, with aesthetic treatments, it's a treatment to soften lines and wrinkles, and that's been the primary treatment through the years. But now there's more of a thrust towards preventative treatments, preventing wrinkles, which is something that a younger age group, people under the age of 40, are very aware of. So is it a good idea to have under the age of 40, or even a younger age, from the age of 18 onwards? So while it's an argument as to what exact age people should start using Botox, I think as people go through their 20s, it's perfectly acceptable to use. And indeed, it tends to be quite a successful treatment. As with many things, it's easier to treat younger people than it is people who are more mature. So when people are younger, they have stronger, more elastic and robust skin, and this reduces the chance of complications such as bruising or bleeding, which are quite small anyway, but nevertheless, the process itself is quite straightforward, and healing occurs very quickly indeed. So when people are younger, they have more elastic skin, and that acts as a better canvas. So when you're relaxing the muscles, the skin over the top looks beautifully smooth. As people are more mature and there's increased laxity, the result tends to be less impressive. And that's not to say you can't treat people when they're older, but you have to be more cautious as there's a higher risk of dropping of the brows or asymmetry. There's a thought also that because the tissues in a young person are tight and without any laxity, there's less chance that the Botox is going to diffuse where it shouldn't do and cause complications such as lid ptosis or any issues with the muscles that move the eye. So one of the main thoughts of treatment when you're younger, or starting treatment with Botox when you're younger, is to have a preventative effect, and that's gained traction over the years. Most importantly, there is something called the twin Botox study, and anecdotally, injectors often find that people who have Botox regularly over a period of years tend to generally look good for their age. So the Botox twin study was looking at 2 identical twins who had Botox or not over the course of 13 years. One twin only had it twice, whereas the other twin had it relatively regularly, probably every 6 months or so on average through the study. As you can see in the pictures, the results are quite striking. The twin who had the Botox regularly has far fewer etched lines and static lines at the end of the study compared to the twin who hadn't had. It's notable also that the twin who was having the Botox regularly through the study was only having it every 6 months or so, and there was still evidence of effect more than 6 months, suggesting that regular Botox over a long period of time can start to work better. So we think that having Botox over a long period of time regularly can reduce the chance of static wrinkles forming, and that's a logical and plausible thought. If you imagine paper folding regularly over a long period of time, it's going to get etched folds within it, and the same goes for the skin. Having Botox regularly over a long period of time can also lead to a cumulative effect in maintaining skin proteins in this area, such as collagen and elastin and some of the other connective tissue proteins. When people have Botox regularly over many years, the muscles tend to shrink, and that leads it to last longer, so many people only need to have it perhaps once or twice a year. Which brings me on to the downsides potentially. So if you're having Botox over a long period of time, maybe years or even decades, and there's never any movement in the muscles, you could start to have significant atrophy and it could start to look unnatural. As a result, I tend to say that every year or two, maybe every 18 to 24 months, patients should consider having a short Botox break. During that period, you could use some skin boosters with hyaluronic acid, amino acids, something like Jalupro Classic, to restore the skin texture and collagen, and then restart the Botox, and that should hopefully prevent muscle atrophy to the degree that it would look unnatural. One of the things everyone worries about with the younger people is having the pressure placed from social media in looking perfect. But I think most people I see these days want a natural appearance and don't want to look absolutely perfect, but prevention is something that many of my patients tend to wonder about. So while I think it's good to have a discussion about the reasons behind Botox and that we can't lead to perfection, it's good to have a good history, and you should always see a medical practitioner to ensure that the treatments are being done for the right reasons. So for upper face Botox, there's three areas as my assistant shows. We've got the forehead here, we've got the glabella between the eyes, and we've got the crow's feet area here as well. So the forehead is a big flat muscle, and this lifts the eyebrows up, inserts into the eyebrows, and it pulls upwards, and this is continuous with the scalp muscle. We've got the glabella, which is a set of about 5 muscles between the eyes which pull the eyebrows inwards and down, and the crow's feet area and the outer eyes, actually the outer part of the ring muscle orbicularis oculi, which closes the eye, and this has a downward pull on the lateral brow, which is of real importance when we're treating females in particular. In a lady, when we want to feminize the brow or maintain the brow position, we often will treat in the inner part of the brow and mark out carefully the vector above the outer brow so that this doesn't drop and we can maintain a nice arch. We can even increase that in someone who's got a flatter brow by treating underneath the eyebrow, so that reduces the downward pull and allows a slight elevation. In men who don't want to be feminized, we don't treat in the same way around the outer brow. We don't want to elevate that, but at the same time we don't want to drop it, so we will tend to treat across, often slightly higher, and men will tend to need a higher dose, often 2 or more times because of the increased muscle bulk. So I always say that precision is really key when you're doing Botox treatment. Many people say it's fine to do in 15 minutes, and you can do the treatment quite quickly, but for a new patient, and when you're assessing and looking at the movement and you're discussing things, it takes a lot longer than that. So once you've planned it all and marked out, it's really important to precisely place the Botox. I use a Swiss-made robot pen called Juva pen, which puts in an extremely precise dose of Botox, so we can just worry about the depth. So when you first see someone for Botox, when they first start having Botox, you don't quite know how they will respond. Some people, for example, in the forehead, you can put in a small amount and they will be absolutely frozen, and other people you need to do much higher doses and repeat this if necessary. So once you know the dose, it can be reproduced, and that's the great thing about the robot pen, is that I can reproduce this and have consistently great results every time. The needles for Botox are tiny. Some people use small insulin syringes. I use the special Juva pen syringes with Invisi needles, which are a 34 gauge needle for Japan, and you can probably hardly see that. So there's no pain relief needed. People don't really need numbing cream, and most people I see hardly feel the injections going in at all. So is there anything that you shouldn't do after Botox? So generally, Botox is a safe and easy treatment, and people can go about their normal day-to-day business afterwards. I usually say just don't do anything extreme on the day of treatment, such as high intensity exercise, just in case that was to wash away the Botox or make it unpredictable. I think that you can have sensible amounts of alcohol on the day of treatment. There's no evidence that that significantly increases bruising risk. And remember, these needles are very, very tiny indeed, so bruising risk is minimal in any case. In my opinion, there is absolutely no evidence or need to alter position and not lie down for a couple of hours, or make sure you stand up or sleep on one side or the other side. In my opinion, that's absolutely fine. You can do whatever you want. It's not going to make any difference to the Botox. And remember, within an hour or two, most of the Botox has gone into the muscle, and after it's gone in the muscle, there's nothing you can do which will make any difference. By the next day, you can quite happily put on makeup. You could do a high intensity exercise or run a marathon if you wanted to. As for further aesthetic treatments, whilst theoretically you probably could do most things safely the next day, maybe it's sensible to have a little bit of caution and separate by a couple of days, but you don't need to separate the next treatment by 2 weeks as sometimes is recommended. So after treatment with Botox, you have little saline lumps in the skin in some cases, but that disappears within 10 minutes. The effects of the Botox depends on the brand, but usually after about 3 to 4 days, most people will start seeing a difference. By about 7 days, the difference starts to be more significant, and by about 10 days, you're getting towards maximum. By 14 days, that's as good as it's going to get. Some people come back for a top-up, particularly when you're starting and you're being a little bit more cautious in the doses. But once you know how much a person needs, it's quite unusual to need any top-ups in my experience. As always with any aesthetic treatments, please go to a medical practitioner who can take a good history, examination, has good knowledge of anatomy, can manage any complications, albeit infrequent, and you know also that they're going to have valid pharmaceutical supply botulinum toxin. So if you've enjoyed the video or if you learned anything, why not click like and you'll be notified by the algorithm of more videos like this. And also please hit subscribe, it'll mean a lot to the channel, and you'll be notified about any future videos that are produced. If you've got any comments, any experience of Botox, anything you'd like to ask about having Botox at a younger age or starting having Botox, well, please leave them in the comments below.